today we're so excited. Dr. Maureen Whelihan have so much to talk about in our second episode of Senior Care Made Simple, all about senior sex. Stick around, you're not going to believe this story. It's hysterical.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
A lot of women are using testosterone to amp up their libido a little bit. So that's probably the hottest thing out there right now in women of all ages is give me some of that testosterone, and it makes them frisky.
Yeah, but what about the hair? You start growing hair or anything like that?
You would think, right? So you know what it does for men, but we use girl doses, right? So we're just trying to make women who want to be women just a little hornier. We don't want them to become man. But I am often surprised at how much we can push the limit and give them more testosterone gel, and it does not give them hair on the face or whatever.
Facial hair.
So we always it's dose dependent. So each conversation is, hey, I'm going to have you use this much, but if you get furry or have acne or something you don't like, then just back off by one pump or because I use a gel.
And what about, Doc, when I have a lot of friends, I'm 61 now, but I had a lot of friends back then when I turned 50 and we were getting menopause at the same time and we have husbands that we love, but then we just lose the desire of having that intimacy with your loved
libido.
one.
That's called libido.
Yeah.
So that there's a biological reason for that. So there in our brain. So our brain has neurotransmitters. Our sex center is in the brain. So when people say, well, it's all in your head, and then the lady leaves the office all aggravated because the internist told her that, well, he's technically right. He just didn't offer any solutions. So the sex center is a mixed match of neurotransmitters, which are our norepinephrine and things that get us excited and do drunk dialing and that kind of stuff, and estrogen and testosterone. So our hormones and our neurotransmitters interact to give us a satisfying sexual encounter. When you go through menopause, you lose all of your estrogen, all of your progesterone, and 50% of your testosterone. So no wonder you feel like a barren desert at the end of that. And neutral. Women become sexually neutral.
Yes.
So neutral says, I could take it or leave it.
Exactly.
Yeah.
Because the majority of those women say, oh God, he's been begging me. So finally I just decided to take one for the team. And when I did that, I don't know why I bitch about this all the time because I really like it. So it's that desire to get going. It's just like, I got to shave. I got to take a shower. I'll pass. And the men are like, what? How can you not like this? It's just so wonderful. And your nipples are hard, which means you want me. No, it's cold in here. I'm
tired.
So what men see and women feel are two different things. So the reason that's happening is because of the loss of our hormones. So there's data that says, for women who just by giving them a little bit of estrogen and progesterone, if you have a uterus, 50% will need nothing else to stimulate their libido. So when I initiate hormone therapy, I say, let's come back in 3 months and we're going to visit again. And at that visit, we've abolished hot flashes. The vagina's good. It's stretchy. It's ready to go. You got the coconut oil slapped on there if you need it. And then is your libido still there? And if the libido's not there yet, then you can add some testosterone. We call that off-label because there's no FDA-approved product for us. But there have been studies, nice 5-year safety and efficacy studies by Susan Davis in Australia. And so we can use it with safety and confidence. And I've been prescribing patients testosterone. And so you can do it without growing fur and acne. Sometimes women will get a little bit of hair at the application site where they apply it. So either they can rotate the site. I usually have women put it on the leg. So if you're going to get a little fur, you can shave your leg. Men would put it on their chest or shoulders. So I caution women, don't read the package insert and do how men do it, because we really don't want a hairy chest unless that's your thing. So hormones are the main reason why we lose interest. Not to mention, you've been married for like 20, 25 years by that point. So you're mostly irritated at your partner or spouse at that point. You don't really like them, but you love them. So you're trying to deal with that. And many women say, he understands. No, he doesn't.
No, he doesn't.
So if he understands too much, that just means he's getting satisfied somewhere else. So he may be kind, he may be sensitive, but he doesn't understand because he can't imagine why you don't want such a wonderful thing that he could dig into every day.
What about fog brain? When you go into menopause, you go into fog brain.
Yeah. So foggy brain, that's like that, fatigue, joint pain. Those are some interesting sort of side complaints on menopause. So there's not a lot of direct correlation between, hey, if I give you estrogen, I'm going to get rid of your foggy brain. The first thing I think about with foggy brain is, how are you sleeping? We have to sleep 7 to 8 hours every night. And if not, it rules the world. Sleep rules the world. It rules our libido. It rules our appetite. It rules our energy. It rules our mood. It is so important. So I always dig into sleep first. People say, no, I'm fine with 6 hours. No, it's not really good for you. And long-term sleep deprivation can lead to memory loss and dementia. So all of these discussions are about staying healthy with a healthy body and a healthy brain and healthy sex for a lifetime. So foggy brain, first I think sleep. If they're sleeping 7 to 8 hours, my next real thought is mood. So I investigate how they did after their babies in the postpartum period, really a dramatic hormone swing that happens then. And so if they needed a little bit of mood med during that time in the postpartum depression, it gives me a little bit of insight. But if it's a gal who shot out 4 babies, did fine, never had any problems, now she's losing her hormones, and now she's having this clarity of thinking issue, it's probably estrogen. And if I give estrogen, I'm probably going to make her better. So that's how I think through foggy brain. But such an important thing. Women are multitaskers, and the minute they can't do 6 things at once, they're really upset.
Yes, absolutely.
Oh, absolutely. Especially me. I go 100 miles an hour.
All the time.
Yes.
I know. You wrote an article on sleep, so we'll bring you in next time to talk about that because it was amazing.
Men and women need to know about sleep.
Yeah, because sleep is
bad
important.
sleep in men, not a good erection. So
No. Or any erection, period.
I know.
If people be more aware of somebody like you that can help them, with this situation, losing that feeling, like you said, because it's painful, they're premenopause or they're menopause, or sometimes it's just, I think couples, what I have seen in my lifetime, especially I have experienced that on myself, is sometimes couple hurt each other so much that, the woman is more sensitive, the man is more physical. Mm-hmm. So it doesn't bother them as much, but the women is a little more emotional. Mm-hmm. So that I think is part of it as well. Don't you, Doc?
Yes. And, as the hormones go, estrogen is a very emotional hormone. Women are worried. Does Kate know I went to lunch with Sue? We didn't invite her because we had this project, but do you think she's mad at me now? And men are going, who cares?
Yeah.
Right? Because estrogen is about emotion and making everyone happy. Testosterone is very concrete. Whatever. It is what it is. Let's fix it. I don't care what Sue thinks. It wasn't the reason.
Exactly.
That's why they get into that little sliver. How does my butt look in this dress? It's like, oh, I'm not answering that one because if I say it looks good, then you're going to question me on that. If I say it doesn't look good, you're going to question. It's like you have to understand the estrogen brain and the testosterone brain. And men are just the easiest clients when it comes to sexual health because for a good erection, they'll follow any instruction that you give them. And they don't get emotional about the conversation. They just go, okay, This is what it is. All right, let's solve it. Women want to dance around it. Well, I was mad at him this week because he threw his underwear on the floor by the basket instead of putting it in the hamper. Stuff like that. It's like, we got to get over that.
Exactly. No, that's awesome. This is wonderful.
So I'm ready to call you. Are you taking new patients?
Of course, my waiting list is about 3 months right now. I think I'm booking into early March. When somebody is looking for a provider, let's assume they're not in this area, for the sexual health specific stuff, I mentioned earlier in the program, ISWISH, the International Society for the Study of Women's Sexual Health. So that's ISSWSH.org. So I'm used to writing it and not saying it on a mic. Ishwish.org, and then you can find a provider on the main page, and it will list in your city or state who is a sexual health expert, and many of them also do hormones. So that's sort of a double whammy. Another one is menopause.org. Menopause.org is the Menopause Society website, and that's all of your menopause practitioners who know this data that we're talking about today and will fully understand who can go on hormones and what hormones they have based on their complaint. And some of them know some sexual health stuff too. So if it's all sexual health, ishwish.org. If it's hormones more than sexual health, there's a lot of crossover on both platforms.
That's wonderful. Thank you so much, Doc. We're so happy that you have come in our podcast today. This is very informative for everybody, including our producer.
Yeah, he hasn't said a word. So you
he needs a cigarette after this.
Oh, that's for sure. That's for sure. And a martini.
There you go. We should have had one together. It could even be more flavorful.
Exactly.
You have a newsletter?
No real newsletter. On my website, there's some videos. I have they're sort of old YouTubes, but they're Sex Clinic Doctor. SEX Clinic, CLINIC, Dr. DOCTOR. If you go on YouTube for Sex Clinic Doctor, some of them are 15 years old, but sex doesn't change that much. Right. So there's some good ideas for specific problems, so they can start getting some ideas, and then they can write in and tell you what they want to hear about.
There you go. Because I read your articles on LinkedIn.
Yeah, LinkedIn. I try and post them there, and then I usually repost those on Facebook. Because people want to know this stuff. Yes. I usually watch the analytics and see, what's important. Mm-hmm. Obviously anything that's sex gets a lot of attention.
Absolutely.
And then, there's a series of, I'll call lurkers, and the lurkers make sure that they have all their privacy screens on, and then they read. A lot of times when I write stuff about male function, and I always try and put a really funny title to it, so that it diffuses the situation and doesn't make somebody feel like they're broken, especially with premature ejaculation or delayed ejaculation. Trying to put some humor behind it, because this is stuff that if you just talk about it, has a solution.
Oh, absolutely, which is wonderful.
So there's a quote on one of your articles, and I'm a golfer, and it says here, sex and golf are two things you can enjoy even if you're not good at them.
That's Kevin Costner. Yeah.
Loved it. I loved it.
I used to have one on my slide deck for my presentations when I would go to some of the different clubs and hospitals, and it was a Barbara Bush comment about oral sex, and said Clinton lied.
Clinton led. A man might forget where he parks or where he lives,
but he never forgets oral sex. Yes,
no matter how bad it was.
No matter how bad it is. So that was Barbara Bush. That was Barbara Bush, probably back in the Monica Lewinsky days.
Yes.
But when I read that, I see her sitting there so poised in her nicely done hair from the hair salon, and here she is talking about oral sex. Well, I was doing this giant breast cancer symposia down in Memorial, down in Broward, and the team that invited me to speak was censoring me. I mean, that was like one of my opening slides, because I wanted to make everybody laugh so that they would relax that I was going to talk about sex and be funny. And they tried to get me to remove the slide. And I thought, and there was a couple other things they wanted me to remove in the program later on. And I was like, but this is my thing, you know? So I called up my mentor and I'm like, can they do this? And he said, no, they can't. And he goes, but you might not ever get invited back if you proceed. And I was like, well, I don't care about that. They're the ones missing out if they don't have me back.
Exactly.
And so I thought, I felt so thrown off of my program because this is just how I loosen up the audience. And so here all these people were sitting behind me, and I got up and started, and I thought, screw it, I'm going to do it. And I just rolled it out, and the audience roared. They were laughing, and I thought, okay, thank goodness. And I went through my whole program. At the end, these young women, these were young women physicians, came up and said, I'm sorry that we asked you to remove those. Clearly, we're more inhibited than our patients.
I love it.
And I said, that's true.
Yeah, get a life.
Wow.
So anyway,
Okay, I want to end it with this one. Sex at 90 is like trying to shoot pool with a rope.
George Burns.
Yes, love it.
So I did, in that same piece, I talked about, or maybe it wasn't in that, but I've written in some of my pieces that men over 90, first of all, hallelujah that you're still living, given that your life expectancy is mid-70s, right? Good for you. So you would think they're just struggling to hang out. No. Men over 90, the majority of them think about sex at least once a day and attempt masturbation at least once a week.
There you go.
Really?
Yes.
Yes.
Wow.
So one final story. All right. So this couple comes in. Whenever the man shows up, I always am thinking, okay, he wants to either make sure she tells me something or he's got to ask something that she won't. So this guy is sitting there. The woman is 95 and she's on the table and he's 93. They both look good. And he's leaning on his walker, one of those traditional aluminum walkers. And so when it got to the exam and I sort of laid her on the table and she's looking at him going, don't look over here, like look away. And I said, are you kidding? What do you think he came here for today? He was trying to get a glimpse of you naked. And she said, he doesn't want to see this bag of wrinkles. And I said, au contraire. What he's thinking is when you were laying on the beach, when you were about 36 and you had your swimsuit on and he was envisioning you at a younger day and he was like bobbing his head like, mm-hmm. And she giggled and I'm like, so let him take a little glimpse. And then I said, you want to come and see my view? And he's like, no, that's fine. But
That's the best.
But here women are in their 90s still worrying about their old bag of wrinkles, like not wanting to be naked. That should be a whole show in itself about women and body image and how we torture ourselves with not wanting to get naked. Men are like Shallow Hal. When they see you naked, they think you're a size 6 stripper just ready to go for them. They just don't see all the saggy boobs and the belly fat and all the other stuff. So body image, really important at all ages.
Again,
All right.
like you said,
We could talk all day,
It's
but
one of the
I know we can't.
hormones. Remember?
Yeah.
Like you said, it's one of the feminine hormones.
Oh, yeah. We're
Not the
so
progesterone,
worried.
right?
Exactly. So
Love
anyway.
it. Love it. It's been a pleasure. You're amazing. We're bringing you back for sure.
Maybe we should just create a podcast with
Just
Doc.
for her.
I know. This is
for her.
awesome.
Yeah,
Fun stuff.
This is
absolutely.
awesome. Senior sex made simple.
Oh,
That's great. We should do it on the podcast.
He's been creating
Senior
the whole
sex
time.
made simple.
That's
That would be awesome because
told
there's
you
so
we're
much
changing
things that we
it.
talk about
I'm
it, right?
telling you.
Yeah.
Yeah, we have to spin things off. We have to think out of the box and give it, for 2026, we're going to make a shift.
And we always try to get everybody to be educated as much as they can so they can have, longevity, happy, healthy life. Just the fact that you aging doesn't mean life stops, right?
Right.
Life should be getting better.
Right.
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 And so we have talked a lot about those things, but having you on the show has been very exciting for us because it is part of how can we help our seniors think differently, because people are living longer, and you do have a lot of older couples that are still together, or the one spouse passed and now they moved on with somebody else, and now she's not as sexually active. Now he wants to be sexually active. How can we help them?
So I'm gonna tell you the last one that I just was like, that one caught me off guard. Lady in her late 80s, she was having vaginal irritation, sort of an everyday gynecology thing. She was new to my practice. Came in, I saw that she was red. I knew exactly it was yeast. She was a diabetic, and finished up the exam, told her how we were going to take care of it. She also had to wear Depends undergarments because of leaking, so that contributes to some of the irritation. But she just wasn't quite satisfied with that as an answer. And so something else was on her mind. And so I said, what else? And she said, let me ask you something. She says, and she got into this whole conversation about her boyfriend doesn't floss his teeth. And I thought, oh, well, kissing is so important in good sex that, especially in the beginning, in a new relationship. I said, well, I can talk to him about the importance of that. She says, I just am worried that he's got a lot of bacteria in his mouth. And I'm like, yeah. She goes, so when he goes down on me, could it be that the bacteria from him not flossing is causing this irritation? And it finally connected with me where she was going with it. And I'm like, oh, so I'm thinking, yay, that she's got a boyfriend in his 80s that can manage to get in the right position to satisfy her with oral sex. B, that she loves her oral sex and sort of mandates that this is going to happen, but she's giving it a little pause because he's not flossing. And could this be why she has the rash? So I reassured her that the rash that she had nothing to do with his lack of flossing, but that I would talk to him about good dental hygiene, and that the mouth is cleaner than the vagina overall, that there's 13 different bacteria that naturally live in the vagina. So it's a wash, no pun intended. And then I brought him in the room, and I just couldn't help but smile when I was looking at him and talking to him like, you character there. You pervert. Like, good for you for taking care. And then my side thought is, doesn't he recognize this rash? He is an adventurous boy if he doesn't look and go, I think I need to come back later on that. So anyway,
You're the best.
But we can fix all of that. So you find a good smile out of a story that just thought was regular vaginitis yeast infection. That can be sexy too.
Oh my God.
This is great.
So I guess we're gonna change that to senior sex made simple.
There you go.
After 60.
So important. So important.
Well, I am so grateful that you came. And I am so happy, and we had so much fun with you. So I thank you.
My pleasure.
I hope that all the listeners really I'm sure they will, and I'm sure they're going to email us and say, please, can we have her again? We absolutely love her. And so thanks, everybody. Have a wonderful rest of your week. This is Andrea Albertini, Doris Muscarella, Senior Care Made Simple podcast. If any of you are interested in speaking in our podcast or talk about any topics that you may want us to talk about it, please email us at seniorcaremade-simple-podcast@gmail.com. Senior Care Made Simple podcast@gmail.com. Have a great day, everybody.
Thank you.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.